Oh,
We're just getting everything ready, folks. Welcome to Fertility Fact or Fiction. I am your barefoot host, Dr. Rahi Victory. Hey, everybody, I'm Dr. Rahi Victory, and welcome to Fertility Fact or Fiction, our weekly show on the internet where we share all things wild, wacky, and wonderful about the fertility world. We do try and present topics usually in a paper, but there has just been nothing good out recently. There are one or two that are coming, and so we will probably review those. But so far, I've not seen anything great. For those of you that kind of follow, I was in Berlin recently at a conference helping people who are trying to use either an egg donor or a surrogate or both to have families. So, huge debt of thanks to Lisa and Carrie, who are on our team and joined us there. And we had an amazing time. Also, Will and Bal are very dear friends who came all the way from Ireland to rep us there and help us out. And we had a phenomenal time. I actually have not laughed that hard in a very long time. So some really good food, a really good time. Did a couple of museum tours, a walking tour, a bunch of different things that we saw in Berlin. I saw the not the Great Wall. Oh my God, I saw the
the
wall,
wall that they tore down.
and apparently when they tore down the wall, they sold chunks of it
Oh, really?
as like a
Memento?
memento. So I was like, oh, I could just chisel a piece of the wall. I was like,
Cut that middleman right
I
out.
cut that. But like it's just crumbling there, right? There's
Yeah,
pieces.
yeah. It's old
But
wall.
it's pretty amazing. And then they were showing how people got over the wall, and one guy like threw like a um like a harness and a rope across from the top of this like government building across to West Berlin,
Wow.
and he put his kids in this like sack and he like slid them down like one of those
Really?
pulley system things. Yeah, just kids slid across the wall. Yeah, crazy.
Unbelievable.
Yeah, yeah, it was wild. So,
The
anyways,
world 100 years ago was a completely
it
different
was a
place.
different place. Yeah,
It was a
yeah.
completely different place.
So great trip. Thank you to my team that came with me. Thank you to my team that put up with my absence. And it's pretty official now. We are super excited to introduce Dr. Shireen Rahal. She is going to be joining us here at VRC as Dr. Pattinson has elected to close down his practice. And so we are very, very excited to have Shireen join us. I've known her for a very long time. Back when she was a resident, I used to train her. And so I'm super excited that she's coming to join me here as a partner here at VRC, and we're thrilled to have her join us, help us with procedures and knowledge and all of her skills, as well as seeing gynecologic patients. She will not be doing OB past the first 12 weeks, as far as I know, but we're super happy to have her here, and she's going to be a great addition. And St. Catharines and Woodstock are going to be ready to go very soon, so we're excited about that too. Lots of changes. Tarek was adding the locations to the website
Yeah,
today.
that's
So
right. Coming
yeah,
soon. Coming soon.
yeah. And I am slightly still on Berlin time, so it's currently 2 in the morning there. So if I yawn once or twice, please forgive me. But I think I've pretty much adjusted already. All right. Oh, and by the way, my flight got canceled yesterday on my way
The
back.
Windsor flight?
No, the whole damn flight
The
got.
Ger the Germany
So
to
I was
Toronto?
supposed to go Berlin, Munich with
Yeah.
Lisa and Carrie, but they left on an earlier flight. And then I was supposed to go Munich, Toronto, and then
Yeah.
Toronto, Windsor. So I show up at the airport, I'm all on time, I get through
Yeah.
security, everything.
Yeah.
And then they go, yeah, your flight's canceled.
Canceled.
Canceled, like done. Well, first it was delayed, then it was canceled.
Canceled.
Yeah. And then without calling me or anything, I just get an email that says, your flight's to Amsterdam is taking off in like 5 seconds, and I had to go tearing through the
You know,
airport
that happened to me last time
to
I was
get
in,
there.
but it was Air Canada, right? They were the ones facilitating. Yeah.
Well, that was
Through
Lufthansa.
Lufthansa?
Yeah,
Air Canada, you booked it through Air Canada.
I booked it through Air Canada.
Same thing happened to me
Yeah,
last time I traveled.
yeah.
Uh, the flight I was supposed to go on canceled. The next flight I went on delayed, delayed, delayed. Then they said it's my flight. I went on there, full, no room for me somehow, and that was my my flight. So like, okay, now you need to go. We'll take you to. I think I went to Czechoslovakia. I swear to God, I had to go into some Eastern European country, some small one, and from there try and catch your flight.
Yeah, it was crazy.
And the problem with that airport, it was so small. I had to get out of the airport, like physically out, to go back in to get into the international part.
Yeah, oh, I know. It was bonkers. Like I didn't have to do that, but I landed in Amsterdam. Never seen so many people in an airport. Like this
Really?
wave of people just come towards me. Like, yeah. So then ran for my connection there, and I made my connection. But my bag, I don't know where my bag is.
Till now?
Yeah, it's supposed to like come tonight.
No way.
Yeah.
Still missing.
Yeah. But I got my air tag in there, so I'll find out where it is. But I didn't have time to look because I was getting ready for the show. Yeah. Yeah. Anyways.
I didn't know you.
Yeah.
All right, got a lot of questions.
Okay, fire away.
We'll start on TikTok, and then some people are saying that the audio on TikTok is coming from the phone. It doesn't come from the mic. That's correct.
That is
the audio for TikTok does come from the phone.
It does come from the phone.
That is an astute observation.
Now, the reason for that is, for some reason, when we mix TikTok into the software that we use to broadcast to all the different platforms, it messes up the ability for people to watch it on TikTok. So we used to get way less viewers on TikTok if we did it through this multi-platform app. So we just do it off the phone. But it might be that it's so far away they're having trouble hearing.
It's usually there, isn't it? I don't think it's usually farther.
Well, it's probably a bit closer usually.
You know what we can do? We can get a microphone for your phone.
Can we?
Yeah, we'll do that.
All right.
Then we'll alleviate that problem.
Okay.
Next week we'll have a whole microphone set up. Another microphone. So you have two microphones. Yeah. Why not? Why not?
Is it going to be something like this? A huge one like this? Or just a little?
Just a little one. Bluetooth.
Oh, okay, sure.
We got a Bluetooth.
Yeah. Okay.
So we'll go from TikTok.
TikTok.
If 100 units a day of 7 days of Puragon didn't have a response, what are the odds 5 milligrams letrozole and 50 units of Puragon will work?
I can't answer that without knowing more about you. I need to know why it didn't work. Is it diminished ovarian reserve? Is it obesity? Is it PCOS? Like I need to know more about you. I can't really answer that. There's always a chance, but that's probably the most I can offer.
Hello, Dr. V and the superb Mr. T.
Oh, look at that.
Is microneedling or laser hair removal safe in pregnancy?
No, neither of those would be okay in pregnancy. Yeah, nope.
Dr. V, I have thin lining in doing your endo protocol. What do you suggest before transfer?
A smidgen of estrogen, like 1 milligram a day. That's what we do. Maximum 2, but that's all you need.
Why do you get lower back pain during the 2-week wait after an FET?
That's a great question. I have not had anyone tell me that they had lower back pain. I mean, it could be progesterone effect, I guess. That's possible.
I would say just being nervous.
I was going to say, you're probably not moving around a lot, which might make some pain occur as well if you're like sitting on the couch the whole time because you're worried. But it could be psychosomatic as well. I mean, I don't think that there's any other reason. Yeah.
What are the optimum levels of estrogen post-transfer endo, and how can I be under your care from UK? Can't travel back and forth from Canada, sadly, due to work.
We have lots of patients that are from the UK that are under our care. We're just in the UK, actually, at Growing Families. Dr. Mayran was there, and then I'm going to be at the London Fertility Show, so come meet us at the London Fertility Show. But if you're watching from the UK, yeah, we can offer you advice and management and stuff like that. I can't actually manage you there yet, but I'm working on that as well. But yeah, it's very possible. We've had many patients from the UK, like loads. It's probably 5 or 10% of our practice. It's very busy with UK patients.
Hi, Dr. VNT. A question about fertility.
Okay.
It seems to test the vaginal microbiome. How accurate and effective is that versus testing intrauterine?
No, it tests both. It tests intrauterine and it tests the vaginal. So it's not just one, it's testing both.
Good evening, docs.
Hello.
Hello. I'm part of that. Fertile docs. Is there any herbal teas? Oh, what a coincidence.
You know, his head is getting bigger and bigger every. We're going to need a new studio just to fit his head in.
Yeah,
here.
100%. I'm convinced.
Yeah.
Is there any herbal teas that should be avoided when pregnant, or specific ingredients that are not safe in teas? Recently drank a tea that had hibiscus and am now worried.
I don't know specifically about hibiscus. I avoid those like red raspberry tea that people tell you to take, because I have seen people take it and have preeclampsia and bad reactions and stuff like that. In general, if you're going to drink tea, just drink black tea, no more than one a day, or just drink green tea, but don't get into all the fancy stuff. Just simple. Keep it simple.
Hibiscus tea is known to bring down your blood pressure.
Is it?
Mm-hmm.
Really?
100%.
I did not know that.
You
How
know,
do you know that?
So hibiscus tea is somehow like this big Egyptian thing. Like people go nuts on it.
It's an Egyptian thing.
So people go nuts on it all the time. I don't know if it's an Egyptian thing, but people in Egypt,
Everybody's taking hibiscus.
they drink
tea.
that when they're sick. They got a sore throat. Like it's a go-to thing. So I'm in my office one time, and my dad from Egypt brings me like this bag of dried hibiscus. It's like a flower, right? Dried flower. And I drink like 5-6 cups of it. And I can't make it past noon. I'm like dying. I can't focus. I'm so tired. I want to sleep, and I can't figure it out. Like I was so.
And it was the hibiscus tea.
So then I look up hibiscus tea side effects, or what does it do? What's so fancy about this for real? Like instead of some Egyptian wise tale, like what's the deal? Drops your blood pressure. So I took enough that it actually made a substantial difference.
You were coding.
I was 100%. I was 100%.
Okay. Wow.
So
hibiscus tea.
Hibiscus
I
tea.
don't even think I've ever had it. Now, do you still drink hibiscus tea?
That was the last time I drank it.
That was the last time you drank it.
But there's nothing wrong with it. It still tastes nice. It's a good tea. It's a nice tea, but there's a blood pressure thing for sure. So I don't know if that has anything to do with the answer that you would then suggest.
Interesting.
But it's for sure got some blood pressure written all over it.
Well, I wouldn't be taking any kind of like medically altering tea. I would avoid.
Yeah. It's not intentional. It's just that's what those leaves do.
Yeah.
You know what I mean?
Yeah.
I had no idea. It was a hell of a day. Yeah. So that's my 2 cents on that.
Candace is saying, I want, to spearmint tea. Yeah, Candace, go ahead and have your any green tea, mint tea, those are fine.
Yeah, green tea's good. Ducks are attacking. Hi, Dr. VNT. What does a monitored cycle look like at VRC? Is it blood work and ultrasounds? If so, how often, and thanks?
Like, it depends on what kind of monitoring. If you mean natural cycle monitoring, probably come in on day 3 and then 8, 10, 12, 14. If you're talking about monitoring for IUI or IVF, it depends on how many eggs you have and how careful we need to be and stuff like that. So usually minimum 4 or 5 times. If it's like natural cycle monitoring, 5's probably a lot, but 4 times. Minimum 3 for sure. Yeah.
My husband has 68,000 count. Is it possible to conceive from IVF with ICSI?
Yeah, absolutely. I've done it for a guy that had 20 sperm, not 20,000, just the number 20. And we got them twins. So it's still possible.
What up?
What up?
Dr. V, my spotting has ceased.
Okay.
Emoji, face, blowing balloons and stuff. Celebration emoji.
That's great.
Hello, aspiring Dr. T. Yeah. That's what it is. That's the word on the street.
If one of you watching the show currently could get me something on Amazon that will deflate heads, that would be lovely.
Nobody ever wants that. It's not something people look for, I'm telling you.
Yeah.
What does a monitor? That's tricky. Ass everywhere. Hi, Doc. I'm homogeneous for 677T.
Yeah.
Do I need to take baby aspirin for the rest of my life, or just when I'm pregnant?
So they're hetero or they're homo?
Homozygous.
Yeah. So I would say in pregnancy, probably aspirin and heparin. Outside of pregnancy, probably talk to your doctor. The clotting risk outside of pregnancy is probably not that high, but you might want to stay on a baby aspirin. I mean, aspirin has lots of other health benefits. So as long as you don't have risk factors, you'd probably be fine.
On to Instagram. My endometrioma ruptured and the ultrasound showed hemorrhage. That was about a week ago and I'm still in terrible pain. Pelvic, back, hips. How long will this last?
So endometriomas almost never rupture. So I'm kind of surprised to hear that it ruptured. Hemorrhagic cysts rupture, but the wall of an endometrioma is so thick, like I've almost never seen one rupture, spontaneously at least. How long will it last? I mean, it depends if you're bleeding internally or not. So I mean, I would go get that checked out.
Hi, Dr. VNT.
Okay.
How to know if a clinic's lab is good or not? Oof.
Ask for their success rates. Ask for what they use as techniques for complicated cases. So if everybody's getting the same treatment, that's probably not a great lab. If they're using different techniques, for example, Neupogen media, oocyte activation, special sperm selection processes, things like that, that's probably a lab that at least is willing to try different things. The other part of the lab, who's working there, right? Like how long have they been an embryologist for? How many cases have they done? What kind of skill set do they have? What kind of training do they have? What kind of tests have they passed? That sort of stuff is important.
Does resveratrol and curcumin increase NK cell numbers?
Not that I'm aware of.
First time doing IVF, unexplained infertility, and Hashimoto's. 3 failed IUI with letrozole, 1 ruptured ectopic.
Oh,
Any specific cycle recommendations?
Yeah. Make sure your thyroid's good before you go into it. Be on the appropriate dose of meds. Don't go on birth control pill before you go in. If you're unexplained, I guess you're going to want to know what was actually wrong. So I'd want to kind of focus on, what was actually wrong. So, find out if they can get you a diagnosis. Not that IVF is wrong. IVF is great treatment for unexplained infertility. But if it's, for example, endo or adeno, the IVF is not going to overcome that, which is still being told to people all the time. So there was a post on Instagram about a lady that I think I put it up on her story, where on her ultrasound, it said like adenomyosis, fibroid, stuff like this. And they never even told her that was on the ultrasound. I got another patient that read that and then messaged me and told me that she had a 9-centimeter fibroid. 9 centimeters. I mean, that's a big fibroid, right? Huge. And they told her it didn't matter.
Oh, wow.
Like,
Dr. T would disagree with that.
Yeah, see, even Dr. T disagrees.
9 centimeters.
That's if he disagrees, come on.
Yeah,
right?
come on. Everyone should be.
Yeah, so I mean, like ridiculous, completely bonkers, nuts, like over the top, and people don't care. And there was just another. It was one of the studies I thought about presenting, but it was kind of too basic. So there's another study coming out very soon that shows that if you have endo, you decrease your chances of success, even when you're doing IVF. So when they tell you that IVF overcomes endo, it's just absolutely not true. It doesn't. Yeah, you got
to deal with it.
You still need to deal with the endo.
Yeah.
Yeah.
Endometriosis is one of the first subjects we talked about in this relationship of ours.
Was it really?
Yeah. I remember you telling me that, people think endo, you can solve it by doing how to treat endo.
Right.
And you were thinking people were suggesting you could treat it, by ultrasound, you can diagnose it or, No, you got to get in there.
Nope.
Yeah, I remember that.
Yep.
Endo's
it's a bitch.
Yeah, it's a real issue. It's a real issue.
Yeah.
Well said.
Well said.
I'm doing donor egg IVF,
Oh, cool.
and I have 1 day 6 euploid BA embryo. And should I do a natural modified letrozole cycle or HRT? I'm regular and ovulate and have no uterine issues such as fibroids. Been pregnant several times but miscarry cause of my age.
Um, Real quickly, yes, Carly, all the way to the end. Yeah, so okay, I got a couple of questions there. How did you do a donor egg cycle and only end up with one embryo would be my first question, because that's very unusual, unless you were using frozen eggs and had very few. But more importantly, I mean, you've only got one embryo, so I would be doing everything to optimize. So we would certainly talk to you about the opportunity to do Fertilysis to kind of maximize your success rates. And then beyond that, we would also want to chat with you about, a letrozole protocol for sure. That is proven to have the highest success rates and the lowest risk of miscarriage. So, yeah, I mean, I would take every precaution and every scientific, sort of path that I could to maximize my chances of success because we're dealing with only one donor egg embryo. So A, I appreciate the fact that you probably spent a fortune for that one embryo. And B, I don't want to mess up your chances. So yeah, we would kind of offer you everything we could to give you the very, very best chance possible, whatever that meant for you. Now, I would need to know your particular history, but it's still really important to try and maximize everything.
Is red raspberry leaf tea still recommended to take before labor?
No,
My doula told me that it's no longer recommended.
no, it never has been recommended, and you should stay off of it. That stuff has prostaglandins in it, and it can cause problems, so stay away.
Hi, doctor.
Hello.
I'm currently doing IVF.
Okay.
I have endometriosis. I am
Okay.
having a lap next week.
Okay.
Do you recommend suppression after lap before I do my transfer?
Well, before or during, but yes, for sure. Someone asked me this the other day too, like you're never going to get all of the endo when you do a lap, no matter how good you are. I did endo surgery for 3 different people today. I got every single spot I could find. I'm still going to suppress them because even though I got all the spots I could find, you're never getting rid of all the endo. There's going to be cells here and there where they're individual cells. They're still multiplying. You can't see them yet. So yeah, you should always be suppressed. The suppression is what actually does the most. The surgery is helpful. Like one of the patients that I had today had a glob of endo about that big. I mean, suppression's not going to take care of that. You need to get in there and excise that, which we did, but you got to make sure that you are treating everything, and you can't treat everything because you can't see everything. So the best way to do that is suppression therapy with the surgery for the bigger parts, and then the suppression for everything you didn't get.
If lining needs estrogen to grow, how does an aromatase inhibitor letrozole cycle work for FET?
It doesn't prevent you from growing your lining. It's just keeping the estrogen level lower. So you don't need a sky high estrogen level to grow your lining. You just need a minimum amount, right? So that's just keeping it low.
Hi, Dr. T, can you get PRP during the last month of Lupron if downregulating before your FET, or do you have to wait until you start your cycle?
Nope, you can do it. No problem at all.
How can
We've
late
done that a
ovulation?
lot.
Oh, sorry. How can late ovulation be corrected?
Clomid, letrozole, injectables. There's lots of different ways to do it.
Team Money and Dr. V.
Team Money. Oh, that's a new one.
They're having fun here. Can you explain more about immune protocols you recommend?
Well, that's a big topic.
Big topic. Huge.
I'll give you some basics. If you have elevated NK cells, there are various options for you. Intralipids, steroids, Plaquenil, vaginal Viagra works fairly well. When we had it, SCIG and IVIG is still available, but very expensive. So there are a variety of different things that can manage your natural killer cells. If you have natural killer cell cytotoxicity, intralipids is quite good, as are SCIG and IVIG. If you have low T regulatory cells, you need LIT. If you have high cytokine ratios, you need either tacrolimus or sirolimus, or you could try Humira. All of those are reasonable. If you have low antipaternal antibodies, you need lit. If you have DQ alpha, we're still not sure, but Fertility strongly believes in lit. And Dr. Zanaku does not, but they disagree on that one. And then if you have the KIR mismatches, that's complicated. You either need a surrogate or you need Neupogen, although I'm not entirely convinced it works. Having said that, one of our patients is about to deliver and she was on it, so who knows? You look puzzled.
Yeah, I was trying to find one of one. They wrote question 2 of 2, but I'm not seeing.
You're not seeing the first part.
I'm not seeing the first part, unfortunately. Okay.
Carly's asking. Oh, I saw a Carly question.
Yeah.
Do I ever get dry hands from washing them so many times a day? Yes, which is why right next to me here, and you'll sometimes see me using it, is a dozen different types of hand cream because I need these constantly all through the day. So yes, I'm constantly dousing my hands in cream. If there's like a really busy day, especially if I was on call the night before, and then I got to do like 3 or 4 egg retrievals and 4 or 5 embryo transfers. By the end, my hands are literally on fire. Like I feel like they're on fire, and you can start seeing the skin cracking and stuff. Yeah, they're pretty dry right now. Thanks, Carly. I'm gonna get some hand.
There you go.
Yeah.
Will metformin,
Yeah.
1500, I don't know the units, help with weight loss and insulin resistance?
Insulin resistance.
Insulin resistance.
Yeah, I mean, it'll potentially help a little bit with weight loss. Depends on whether or not you reduce your calories and are exercising and stuff. But from the standpoint of managing insulin resistance, definitely.
Going into IUI cycle 3 with 1 tube, 3 maturing follicles. What are my odds per month with 1 tube?
In an IUI?
Mm-hmm.
Still reasonable. 1 tube doesn't change it very much.
Treatment for RIF. Please advise for frozen transfer.
Oh God, I need to know more about you. I can't answer questions like that, guys, without knowing details. Recurrent implantation failure can be because of something wrong with your uterus in terms of the shape, the volume, the polyps, fibroids, and so on. It could be because of endo or something like adenomyosis. So you have to figure that out with laparoscopy or ultrasound or MRI. For the adeno. It could be from immunological problems. It could be from infectious problems. There's testing for that. Obviously, we support Fertility, but whatever company you want to use that can do it for you is fine. It could be from problems with the sperm quality. It may have nothing to do with you. It could be egg quality related. It could be the genetics of your embryos. I need to know what's going on before I can answer that.
Hi, Dad, says Jay.
Hi, baby. I saw you today. I'm arranging for you and your mama to go to see your schools. For all those of you that didn't watch the show before, Jenna got into 3 different medical schools in the UK, so she needs to go choose which one she wants. So yeah, very cool.
And then one of her friends seems to be here.
One of her friends seems to be
Ariana?
Oh,
maybe. And they asked, "What are you doing here?" And she said, "Learning about fertility."
There you go. She watches to learn. Good girl. Good girl. She's going to be taking over one day, guys. So you'll all be seeing the J, as we call her, at home.
Is your clinic open on Saturdays?
My clinic is open every day but a week at Christmas. That's the only time we don't actually open. Well, even then, we're actually open, but we don't run any kind of cycle. But that's the only time we close. We are open every other day.
How do you choose transfer protocol? How should one advocate? I'm 36, unexplained secondary infertility.
Well, one thing I've been telling people more and more lately is that you need to understand that you're actually in control more than ever, especially with social media. Patients are in control. Like, I have no misunderstanding about this. All it takes is one bad review, one public debacle, one really angry patient to turn your life upside down. Because it doesn't matter even if it's true or not, and frequently it isn't. If a patient says something and it's online, everybody's like, oh, that doctor or that clinic or that nurse or that social media guru must be terrible, right? Like it doesn't matter. And I mean, if anyone knows that, it's T, because that's what he lives and breathes every day, right? So
not negative reviews.
no, not negative reviews. Yeah. So I'll give you guys a great example, okay? And this is out there in the public, so you're welcome to go see it. So I told a young lady that was having severe pelvic pain that she had options for management of her pelvic pain. The options were take pain meds, which is a terrible option, and I explained that to her. Take birth control pill and try and see if that works. Take Vizan and try and see if that works. Take Depo-Provera, which is a horrible drug, especially if you're a young girl, but it's an option. Try a Mirena IUD, reasonable, but not easy to get into a 17-year-old. Or take, and we didn't have Orilissa back then, this is like going back a while, or take Lupron with add-back therapy. And Lupron's a drug that temporarily puts you into menopause, but then the add-back therapy will take care of your symptoms, and none of this is permanent. So when you come out of that and you stop the Lupron, you'll go back to normal. So I explained the risks and benefits of each one. I told her what it all meant. I went through it all with her, and it was all done. So she immediately went on to rate MDs and wrote that I'm a lunatic because I wanted to put her into menopause. That's what she got out of that message, right? And I literally spelled out every single possible option for her. And she didn't like a lot of the other ones. And then she got mad because she thought I was telling her that she needed to go into menopause, which in no time did I say. I said, this drug creates a menopausal-like environment for you and menopausal type state for you. And what I need you to do is understand that this is going to be of benefit to your pelvic pain if it's endo-related or adenomyosis related. So you guys are in control. That's the moral of this story. You're in control. And if you're not happy with your clinic, then tell them you're not happy. And if they're saying, well, too bad for you, then threaten to make a stink, right? Like that's the only way around it. Now, we get requests every day for me to expedite consults and rush someone in and stuff like that. Look, that's not something you can complain about or make us think about. If you call us and say, I'm going to complain if Dr. Victory doesn't see me tomorrow, I'm still not going to see you tomorrow because we have a lineup of other people that would complain even more if they've been waiting and I squeeze someone in. But if you have a legitimate complaint about function, first speak to your clinic, give them a chance to respond. And if they're not responding in an appropriate or reasonable fashion, then either walk and take your business elsewhere, which nobody wants you to do, or threaten, right? There's college you can contact, there's social media you can go on and basically say, look, I'm dissatisfied with the care I'm receiving. I want to be part of my journey. You can't just tell me no every time. Now, clearly, if you're asking us to chant kumbaya with you, that's fine. If you tell us you want to take some crazy medication that we know is going to be harmful, that's a different story. We can refuse. But if you tell your physician, I want a letrozole protocol instead of an HRT protocol, and the physician refuses, that's ignorance. That's not a medically appropriate response. That's someone that's just not reading enough, because very clearly the letrozole protocols are better. So I think you need to realize that you are in control. I hate to boil it down to this, but sadly it's true. You have the money, you're in control. And if it's a funded cycle, like you're in Ontario and you have government funding for your cycle, you're still in a position where you have control because it's still your healthcare. No one can tell you what to do. We can advise, we can guide you, whatever. And yes, your physician doesn't have to do something they're not comfortable with, but they can't refuse you, at least a discussion. You're going to put that on it's going to be its own clip. Yeah. So Mina says, thank you, Dr. V, for confirming I need to advocate for myself. 100%. I hate the fact that you guys need to advocate for yourselves. You really shouldn't need to advocate for yourselves. But yes, definitely recognize all of you, male, female, any of the other options in there. Make sure that you just hit decline. Sorry, guys. So just, realize that you're in control.
Good timing for that.
Yeah.
If there was good time.
Yeah.
Yeah, we did that. Oh, here you go. This is right up your alley. Why do I have a failed transfer? I had 2 frozen transfers, failed. Doctor keeps advising me more frozen transfer.
Yeah, so at the the Canadian Fertility Show in Toronto, and huge thanks to Marissa for setting all that up. She's wonderful. I'd say probably 80% of the people I saw were people that approached me who had had multiple failed embryo transfers. And I actually met a lady in Berlin at the meeting I was at who had, are you ready for this?
Yeah.
Drum roll.
Yeah.
18 egg retrievals.
Oh my
18.
God.
So many people, I know that's crazy.
That's so big.
So many people are having multiple retrievals, multiple embryo transfers. They're not being successful and they're told, just try one more time. So any of you that follow our Instagram know that I'm not a fan of just try one more time. So I'm going to give you the best information that I can to help you be convinced, I hope, not to just try one more time, okay? As a result of our testing with Fertility, I can tell you categorically, because we've actually calculated the number, that in a small sample of patients, we've only done 49 of them so far, 45 of the 49 who previously had failed multiple other cycles got pregnant. That is 91% for those of you that are scrambling for a calculator. So we had a 91% success rate. If we didn't just transfer another one, we actually hit the brakes, figured out what was wrong, treated it, whether it was infection or immune or both or whatever, and then did our embryo transfer. 91%, that's actually higher than even I get with a genetically normal embryo from an egg donor. Like we're getting 83.2% in that category, but 91, nobody's getting 91%. That's as high as I've ever heard of. Now, granted, I'm sure that number will come down as we get more patients coming in, but based on the number we have already, even if I had 0 success in the rest of them, that's a 50% success rate because we did 100 patients at that point. So even if I had 100 patients that got pregnant, 50% of the patients got pregnant, that's still a really good rate in patients that have had multiple previous failures. So to go from 0 to 50, you're doing pretty well. And I don't think it'll be that low. I think we'll actually probably end up somewhere in the 70 to 80% range, which for us is basically normal or close to normal. So I would recommend that you hit the brakes and figure out what's wrong. I never support just trying again. That's a really good way to make your fertility clinic rich and make you poor.
Should I be taking baby aspirin all the way until delivery? This is being asked by Carly.
I answered that one.
You did? Okay.
Yeah, I told Carly she should take it till she's done. Yeah.
Should I ask me about the bear?
Oh, I forgot the bear. Okay, let me answer Candace too. Candace is newly prayers. Candace, your blood sugar goes down because your body is feeding 2 people. And so the hormones change, your insulin requirements change, your sugar changes. And in the first trimester, your blood pressure can take a dip. Plus you're queasy, which also dips your blood pressure. So those can all contribute. Okay, so Tarek told me this crazy.
But before you let them all answer first. Let's actually see. Like tell them, like let them comment. What would they rather?
Okay. Before I what?
No. Like let them actually comment.
Like type in the comment.
Yeah, like let them comment. Type in the comment. What would they do?
What would they do?
I'd like to see it.
Okay, so Tarek told me that somewhere on the internet, and I haven't seen it myself, there is a question about if you had a daughter and like what are we talking, 20, 18?
No
19?
age given.
Oh, no age given. Just
age
you have a
We
daughter.
have a daughter.
Okay. Who would you trust her more with in the forest? So your daughter's alone in the forest, not with you. She's alone in the forest. A man?
Yeah,
I can't even believe I'm asking this. Or a bear. A bear like, grizzly, like, grrr, okay? So which one would you trust more? A man with your daughter or a bear? Now, the reason that this is interesting is because I guess there's a difference in the answer based on who's answering. I'll leave it very general.
Yeah.
But I am very keen. So your answer is who you would trust.
Bear, 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 always a bear. We have become a hell of a species, man. I'm telling you. I can't understand it. They're watching too much Netflix. I'm telling you. I don't know what's going on.
Bear. I would be okay with 3 bears. Can I choose the man?
Can someone choose man?
Candace wants to know if she gets to choose the man. No, you don't get to choose the man. You don't get to choose the bear either. And we're not talking like one of those roly-poly pandas here, right? Like
bear in the forest.
A bear.
Random bear.
Charles is asking, is the man you?
I'm telling you, man.
The man would not be me. I don't think I'd be around in a forest. Although, as far as men with daughters is concerned, I can assure you that I am probably the most overprotective male on the planet because I wouldn't let my daughter out of my sight until she was 18.
I said,
and even then it killed me.
This question was proposed to me, how the hell she got in the forest in the first place? That was my response. I couldn't even deal with the fact that she's already there.
I'm actually kind of, nah, bear.
Bear, I'm not. Bear all the way.
Why is it? Okay, well, I want to know why now. This is actually, we should skip the rest of the show and just, yeah. Is it because we're so bad as a gender, a sex, whatever we are now these days?
Bear, even on Instagram, bear, bear, bear. Oh, the bear.
Oh, look at that. Worst thing bear could do would be to unalive us. Man can always do much worse.
Yeah, but the end result is unalive, I think. I think even if the man wants to do worse, he's still going to polish you off at the end of the day.
Okay, the girls are all asking me about my call schedule. I have no idea what my call schedule is. I literally show up in the morning and Mara goes, you're on call tonight. So ask Mara, don't ask me. Don't ask Mara. I completely take that back. Do not ask Mara. You can call the office and they will find out when I'm on call. Yeah. Bear.
Bear. Bear.
You know what? I need here.
If you're walking down the street,
go open the cabinet there. The one in the back there. Hold on. Yeah, there you go.
I'll be honest, he's pretty cute, this guy.
There you go.
If this is the one, make sure they can. They can see him on TikTok. Yeah. This is what we're dealing with. Right?
All right, there you go. Me or the bear?
They chose bear, man. Somehow.
That actually is quite funny.
I told you won't believe it.
Yeah. Now they're all going to be wondering why I have a teddy bear in my office. I actually have 3 teddy bears in my office. Yeah.
All right. Sorry for that little detour.
Bear. Aw, that's very cute. They all said me.
Like you're not going to be in the forest. I'm pretty sure.
Could get distracted, and then daughter is left with bear in the end, anyways.
It's true. All right. Back to the questions. Small distractions.
Yeah, that's a funny one, isn't it?
I almost got into it. How could you pick bear?
We gotta post that online. Oh. Yeah, we gotta post that.
You got the clip.
I'll post.
So I got the clip. It's over here, so you could just
and then put a poll.
Yeah, if you want, or you could just redo it.
Yeah, and then just tell them why. All right. Yeah, that's good. I like that.
The male species.
Everybody's asking if I'll be on call May 24th for Carly's induction. Don't worry, I will figure out a way to be there. Relax.
I think you need to be there from the sounds of it.
Yeah, I will be there. Don't worry. I'll figure out a way. I will be there. Somehow or other, I will be there. Bear. I can't believe everybody's saying bear. So your daughter's going to die because the bear is going to maul her like she's,
the bear will eat the kid. No questions asked.
Well, the person, it could be, we didn't specify names.
There's a chance the person might be normal. Like, why does he have to be an insane rapist, cannibal.
I
Why
know.
can't he just be a normal guy? Like, men are only
we're all bad.
imperfect.
We're all bad, apparently.
Nothing else. The bigger, better.
That's kind of scary, that we've come to that stage. Although, based on what's happening in the world today, Carly, I'm
Never met a normal guy. I'm telling you, we're normal. We are a normal species.
you and I are pretty normal. Yeah.
I'd like to think so.
Yeah, you and I
think so.
I will vouch for Dr. T. He's pretty normal. Yeah.
I've never met a normal man. See,
That's what I said.
you see there are people have never even met us before. That's
Yeah.
what they're saying. They've never met a normal man before.
You know what? Well, Tarek and I will have like an open house and you can meet two normal guys.
Yeah.
Yeah.
I'll do my rotations.
Dad bods and all.
Jade just got in here and she says incorrect. He's bizarre. Everyone's chiming in. There's no winning today. I'm telling you, there's no winning today.
Jay, it's past your bedtime, even though you're 3 hours behind us.
She also
Thank
wanted me to tell
you.
you, she also wanted me to tell you, tell him I say I love him.
Oh, yeah. Okay, go ahead.
Okay, why? Okay, one ruptured ectopic biochemical pregnancy on IUI number 1. Now on my 3rd IUI cycle.
Is that the one she asked before? 3 eggs,
It must be
1,
connected
2?
to it. Yeah, it must be connected to it. Do you ever get dry hands? Can I talk to you about RIF and IVF for PCOS client, please, and thank you?
Sure. You can talk to me about anything like that.
How long should I try and wait to try for a VBAC?
Minimum 15 months between delivery till pregnancy. You need 24 months, ideally, delivery to delivery.
The bear question still going strong?
Or the bear could adopt my daughter, and then I'd have a literal mama bear.
There you go. Can you talk about being 3 days late?
Well, either it's hormonal, yeah.
Sorry, everybody.
So either you're late because you're pregnant, or you're late because your hormones are disrupted compared to normal. And then there are varieties of reasons why that could happen. Thyroid, stress, food disorder, change of time zone, change in activity, diet, a lot of different things. So vaccination. So yeah, all sorts of issues there.
Hello, doctors T and V.
You've hit your new high, eh?
That's it.
More Dr. T's this time than ever.
And act like a normal person. Can you please explain the natural cycle FET protocol where you start prog at LH surge and transfer on the 5th day of prog? When my now ex-RE explained it, it seemed like he was assuming LH surge equals ovulation if you catch the quote-unquote true peak.
No. So your ovulation peak is somewhere around 18 to 24 hours before you're actually going to peak. So your LH peak is 18 to 24 hours before you're actually going to release your egg. Sometimes longer, but on average 18 to 24 hours. And then most people will go LH plus 7 for the transfer time. You don't actually have to do that. You can start the proj whenever, but that's what most people do when they're doing a natural. It's LH plus 7. So you'd start your proj 5 days back from that plus 7. So basically 2 days after the surge or 1 day after the surge if you want to hedge your bets.
Your daughter picked bear too, right?
My daughter picked bear? You'd rather be in the forest with a bear?
It's everybody.
If I was the man with you, I'd be the one running.
Yeah, there you go. What is the longest you've seen someone take to get a cycle after 7 days Provera?
It should work within 4 or 5 days. Yeah.
What do you recommend after egg retrieval? How do you prep your patients for frozen transfer?
Letrozole, We do cycle day 21 Lupron, then a letrozole protocol, lots of supplements, vitamins. Make sure your thyroid's perfect. Hopefully, Mediterranean diet, exercise, keep your stress low. If you believe in it, acupuncture, that kind of thing. And then we do your embryo transfer when we've done 5 days of progesterone. So once your lining gets to 8 millimeters, we start double proj, vaginal and injectable, and then we go for your embryo transfer.
Hello, Dr. Victory. What can be the best treatment for blocked fallopian tubes with hydrosalpinx army?
With hydrosalpinx, what?
With hydrosalpinx, comma. Oh, I think, it's a bunch of comments later. And my one tube is blocked and I don't have children yet. My age is 40.
Oh, you need them removed because they're not going to allow your tube to work. And it's a 50% reduction in your success with IVF. So you actually need to remove your fallopian tubes and then do IVF, unfortunately. There is no way to unblock blocked tubes that's reliable. You can go to see an interventional radiologist who can try and bust open the tube, but has a very low chance of success. And at 40, I'd be worried about the success of that anyways, because you're going to eat up a lot of time, which at 40 is valuable time. So I'd be thinking about that.
Hello, Dr. B. Can we do lit if I am on antibiotics and steroids, the male?
The male? Yeah, no problem. Yeah.
Dr. B, please do a more in-depth video about immune issues and protocols. I promise it'll go viral.
Okay, give me suggestions as to what you want to know. Maybe I'll just do one with the guys from Fertility. We're actually planning to do that. So
immune issues.
We're going to have to figure out a weekend time where you and I can meet with them because they're 7 hours ahead.
Maybe we should just go to Greece and chill out that blue-white place.
We could.
Clearly work related.
Mara would kill both of us, but we could. Yeah.
Sneak in, sneak out.
Yeah. Someone was asking if there are many high-risk OBs in Windsor. Currently, there are no true fellowship-trained maternal fetal medicine specialists in Windsor. However, with the exception of the very complicated stuff, fetal anomalies, things like that, everybody here is really good at dealing with any degree of complication. Some of us see more of it, like just by virtue of being a fertility specialist, I tend to get a lot of high-risk cases here. So I guess I'm probably as close as they would come to doing high risk, but the wonderful Katie Bartlett, who has joined us here, she's awesome at doing high risk stuff. Tom's, Hazen, JC, Chan, Rollins, Suga, like all of my colleagues, Polsky, everybody here is good. I'm not including everyone because there's a long list, but everybody here is good. And so, yeah, you could see any of us. We all are pretty decent at taking care of stuff.
I ovulated a week ago, and it seems that my period came a week earlier. Did I do anything wrong? Which brings me to my next question. If tracking CM is
cervical mucus
is not reliable, what is best for tracking?
Your LH surge is best for tracking. Nothing else really is. You might have low progesterone or is just a bad cycle. Check your hormones, make sure your thyroid's okay, your prolactin's okay, stuff like that.
Hey, Dr. T, do you use Alvedrol to force ovulation during a letrozole FET if the patient usually ovulates on their own?
No, please.
I would not. Patient ovulates on their own, let them do it.
Let them do it?
Let them do it.
So there was a study we reviewed years ago on the show, which said that if the patient is ovulating naturally, you should not use Ovidrel because it reduces the chances of success. Hold up, don't get too happy.
Let's just stop right there.
Yeah, we can't.
Let's just stop right
But then after that, the group in Hamilton at One Fertility showed that actually it's better to give Ovidrel even when they're ovulating naturally. But that was with IUI.
I was talking about whatever they're talking about.
So it actually is better to do it with IUI. But I'm really glad that you got a Dr. T question for once.
It was a complicated one. I was thinking of referring to you, but I thought, let's give it a shot.
Yeah.
What's the worst that could happen, you know?
Yeah. So the current data supports that you should trigger. Yeah.
So there's some background noise here.
Are we still on the bear?
No. But you should make some VRC merch. And I think that's a great idea.
Make VRC merchandise?
Yeah. Merch rocks. Everyone loves merch. All famous YouTubers have their own merch.
I would only do it in one condition.
Uh-huh.
And that's that we give all the proceeds to people that need fertility. Like we come up with free cycles.
There you go.
That I could handle.
That's a nice one.
Or giving meds to people that can't afford it or whatever. But I would never be able to
start your own foundation.
I couldn't keep that money. Or oh, you know what? That would be good. We could give it to Fertility Friends Foundation.
People would love to wear a VRC.
I forgot my little band thingy for
my little.
Okay, I forgot my. Oh my God, she's gonna kill me. I'm so sorry. I forgot my little Fertility Friends Foundation. But guys, don't forget Fertility Friends Foundation. They're awesome. They give out grants, and now we give out free cycles because of them. Amazing work that they are doing. So Isabel, I'm sorry that I forgot my little thing. I blame jet lag, but nevertheless, make it make the effort to communicate with Fertility Friends Foundation, guys. They're incredible. We could do that. What do you guys? Okay, so give us suggestions. T-shirts with some
hoodie. Everyone's going for a hoodie.
A hoodie. They want hoodies.
People are going nuts for hoodies in the comment section.
Hoodies with like some of our favorite phrases, like we're making babies, we're not baking cookies here, or you're only going to make your doctor rich and you poor. I could do those.
Yeah. Good lines from FFOF. Yeah. Some great. There's a lot of one-liners here.
And then we make. What are we doing? We're selling it on our website, I guess.
That's right.
And then we give the proceeds to either Fertility Friends Foundation or we have our own.
Or you make your own foundation.
I could do that. That I could do. I couldn't keep the money, but because I felt bad. Okay, I didn't tell you this, but I don't know if you saw it in the Instagram. A lady who runs her own yoga business. Did you see that?
Of course, exactly.
Okay, so a lady that runs her own yoga business, yoga fertility business, and by the way, there's actually studies that support the fact that yoga improves your outcomes. So do yoga, it's good. So a lady that does this contacted me and said, listen, I run this business and I'd really love to have you on for 30 or 40 minutes to talk to the women that follow me so that you can answer their questions. She said, what's your availability and how much do you charge? And I was like, charge? I'm not going to charge people to help them. So I said, there is no charge. Like, we're here to help people. But I'd never been asked that before.
All the big shooters.
Like, I'm comfortable if it's a drug company, but if someone's out there like trying to build their business, I'm not going to charge them to spend time with people. We do it for free every bloody week.
That's right.
Anyways.
Carly wants commission.
Commission? You're getting, you can have, you know what? You can have 100% of nothing because we're not going to keep any of it. So was it Carly's idea?
She mentioned we should do merch, yeah.
Really?
Do the merch line in there.
Maybe we hire Carly to do it.
There you go.
All right. Hoodies, and the design is a teddy bear that wears scrubs, and he's holding a pointer stick pointing. Hi, baby. That's my little daughter there. You know what? We have the teddy bear with the, it's out at the front counter, right? Yeah. Okay. I guess we're going to come up with some merch.
9 o'clock at this exact second.
Oh, really? Wow, that flew by. It was because of the bear.
Between the bear and the merch, yeah. And my...
Okay, I want to know from Jenna. Jay, I get to put you in the forest. You get to be with a bear or a man. I want an honest answer, not one of your goofball answers. Which one you staying with? And I get to see you. VRC baby onesies. We actually have one on the butt. It says made by VRC. I will check my text, you monkey, but the phone is in front of me. It's actually videoing me. You have to answer bear or a man. I want to know from my own daughter. Made in VRC lab. Okay, Carly, we could do that. Come on, Jay, give us an answer.
Want a question in the meantime?
Yeah.
Hi, doctor. They left it doctor because they didn't know if it's for
You or me.
Yeah, that's right. What do you advise for someone with multiple fibroids and want to do an embolization procedure?
Embolization.
Yeah, seen many people on YouTube saying they did it and gave birth after. What's your take?
Well, embolization will shrink the volume of your uterus and it'll shrink the size of your fibroids by about 50% of their volume. So we got to do some math here. The volume of a sphere is 4/3 pi r cubed. In English, what that means is if you have a 10 centimeter fibroid, it becomes like a 7.8 centimeter fibroid. So yes, it volumetrically shrinks considerably, but not a ton. So the problem with that is it's not great for comfort, bleeding, even pregnancy, stuff like that. You're supposed to remove fibroids that are larger than 4 centimeters because it improves your success rate. The other problem is the particles that they use are something called polyvinyl alcohol, which probably doesn't belong in the human body. But even if we forgo that, some of those particles do migrate. And so it's not a great thing because if they plug up the uterine vein, which they can get to, sorry, not the uterine vein, the ovarian vein, which they can get to, you can really gum up the whole system and get diminished ovarian reserve. So there are problems with doing embolization procedures. The other problem, fibroid embolization, where they specifically embolize the fibroid, is pretty safe. Uterine artery embolization, which they used to do before, that had a very negative impact on pregnancy. So personally, I don't allow any of my patients to be embolized. Like I offer it to people, but we never encourage them to do it because it's super risky. It doesn't make sense. And I would strongly advise people to go ahead with just removing the fibroids. Easy, safe, in the hands of a good surgeon. You're done. We can feel for all your fibroids, get rid of almost all of them, make sure the stitching and the correction is good. And now they're gone. So it's not about volumetric shrinkage. You're actually like done. They're gone. Jenna said bear earlier. Carly's reminding me. Jenna's gone for some reason. She was texting. So
Made in Canada merch for international patrons, and then the merch could say "bear over the man." That's we're extinct, I think.
When I travel on my own, you don't warn me against bears.
That's not.
Good answer, honey. That's very true. I don't. Although in a forest, if there was a bear in front of you and there was a guy there, I'd probably recommend you run to the guy, not to the bear.
You know that movie that everybody loved,
Cocaine Bear?
No.
Did you see Cocaine Bear?
I saw Cocaine Bear. But that other movie, he's walking zombies. Last of Us.
Yeah.
Man and the little girl.
Oh yeah.
Right.
Well, but he's not the best guy ever.
Still protected her.
Yeah.
Better than the zombies.
Better than the zombies.
You know, the person should really be.
But he was trying to dump her just for, what was it?
Dump her at her place that she was from.
But he only did it to get car parts or something. Oh,
What's the deal with that? Yeah, but then he kept her because she was like, oh, you know. But I couldn't understand being a guy and not wanting to have a little kid around me the whole time. Zombies is a serious thing.
No, it didn't work. You missed it.
Very accurate.
Verification complete. Zombies, yeah,
Right. Last time he protected her the whole time.
I don't know. Okay, we've got low power mode. So, anyways, okay, team. Have a lovely evening. It was good being on with you all. Love you all, and hope you have a great night. Thank you so much for joining us. How do I choose? I'll answer Mita because she asked this. If you look into bear attacks in North America versus attacks on women by men, you'd understand. This whole thing has really become a topic.
So we brought it up.
We should do a special episode just on that topic to find out bear or man, like whichever one. So how do I choose which transfer protocol? Mainly endo, adeno, fibroids, or normal. Age can be a bit of a factor as well. As a general rule, we use letrozole, but not for everybody, but almost for everybody. And then menopause status, non-menopause status, all of these things are important. Okay, guys, have a great night. Thank you again. I'd run into a bear den faster than I run into a room full of men. That's my daughter. No, you wouldn't, you monkey.
You know, I've probably never seen a bear before. If they saw a bear in real life, no one would go to it.
I don't know if Jenna's seen a bear.
No, in real life, like this, like right in front of you with his big mouth and saliva coming down, I'd run.
I don't know. Yes. Jenna says yes. Dina, I know your your sister's coming tomorrow. We will take care of it. You want to hug it? You can hug this one, honey. This is the only bear you get to hug. Okay, or me. I love you. Have a good night. All of you take care. And maybe we should get Jenna on the show.
She's down.
My grandpa had a hunting camp and he had a bear that frequented. Jenna would come on the show. She'd be a riot, actually. She'd be a lot of fun.
Good, eh?
Yeah, she's a people magnet. They love her. Okay, guys, we're gonna sign off. I gotta get home to my wife and get some rest. Have a lovely evening. We will see you next week. Next week on Fertility Factor Fiction, right?